Picture this: you're a nurse on night duty. A patient comes in with a painless lump on the neck. He's sweating heavily, his bedsheet's drenched, and he tells you he's been losing weight without even trying. Now pause for a moment. What's your very first thought? Could this be an infection, or something far more sinister? Tonight, we're diving into Hodgkin's disease NCLEX questions, from easy warm-ups to tricky high-stakes scenarios, testing not only what you know, but how you think under pressure. Stay with me till the end, because the final question may just be the one that could appear on your exam tomorrow. Question 1. A 22-year-old man comes to the clinic with enlarged cervical lymph nodes. They are firm, painless, and rubbery. He denies sore throat or recent infection. Which condition is the nurse most concerned about? A. Acute pharyngitis. B. Hodgkin's disease. C. Influenza. D. Bacterial tonsillitis. Answer B. Hodgkin's disease. Rationale: painless, firm, rubbery lymphadenopathy is the hallmark of Hodgkin's lymphoma. Why not the others? Pharyngitis would have sore throat plus tender nodes. Influenza presents with fever, body aches, not isolated lymphadenopathy. Tonsillitis causes painful, inflamed tonsils plus painful nodes. Question 2. Which unique cell confirms the diagnosis of Hodgkin's disease? A. Philadelphia chromosome. B. Reed-Sternberg cell. C. Plasma cell. D. Giant neutrophil. Answer B. Reed-Sternberg cell. Rationale: classic diagnostic marker, large, multinucleated cell, Alzheimer's appearance. Why not the others? Philadelphia chromosome, linked with chronic myeloid leukemia. Plasma cell, seen in multiple myeloma. Giant neutrophil, not specific to cancer. Question 3. A patient with confirmed Hodgkin's disease reports drenching night sweats, unexplained weight loss, and fever. What do these symptoms indicate? A. Disease remission. B. Localized early-stage disease. C. B. Symptoms: systemic involvement. D. Medication side effect. Answer C. B. Symptoms: systemic involvement. Rationale: fever, night sweats, weight loss equals B. Symptoms: poorer prognosis, advanced spread. Why not the others? Remission: no active symptoms. Localized disease would not have systemic features. Medication side effect: these symptoms are classic systemic disease, not drug toxicity. Question 4. A patient has Hodgkin's lymphoma involving lymph nodes on both sides of the diaphragm and the spleen. According to the Ann Arbor staging system, what stage is this? Stage B, Stage 2C, Stage 3D, Stage 4. Answer C. Stage 3. Rationale: Stage 3 equals lymph node involvement on both sides of diaphragm plus or minus spleen. Why not the others? Stage I, single lymph node region. Stage 2, 2 or more nodes on the same side of diaphragm. Stage 4, involves extralymphatic organs like liver, bone marrow. Question 5. A 28-year-old patient asks, why do I need chemotherapy if the lymph nodes are only in my neck? What's the best nursing response? A. Chemotherapy reduces pain quickly. B. It helps shrink the lymph nodes temporarily. C. It destroys cancer cells that may have spread beyond what scans can see. D. It prevents future infections. Answer C. It destroys cancer cells that may have spread beyond what scans can see. Rationale: even if localized, Hodgkin's is systemic by nature. Chemo ensures eradication of hidden malignant cells. Why not the others? Pain relief, not the main reason. Temporary shrinkage minimizes the importance of chemo. Prevents infections, not true. Chemo actually increases infection risk. Question 6. During chemotherapy for Hodgkin's disease, the patient develops a fever of 101.5 degrees Fahrenheit, 38.6 degrees Celsius, chills, and low WBC count. What is the nurse's priority action? A. Administer acetaminophen and reassess. B. Notify the provider immediately. C. Encourage oral fluids. D. Document and continue monitoring. Answer B. Notify the provider immediately. Rationale: febrile neutropenia is a medical emergency in chemo patients, can be life-threatening infection. Why not the others? Acetaminophen masks fever, delays treatment. Oral fluids, supportive, but not priority. Document/monitor, dangerous delay. Question 7. A 32-year-old male with Hodgkin's disease is worried about infertility due to chemotherapy. What should the nurse discuss first? A. Adoption options after treatment. B. Sperm banking before therapy. C. Hormone replacement after chemo. D. The possibility of natural fertility return. Answer. B. Sperm banking before therapy. Rationale. Chemo/radiation high-risk infertility. Sperm banking before starting treatment is best practice. Why not the others? Adoption, future option, but not priority right now. Hormone replacement addresses hormones, not fertility preservation. Natural fertility may return, but risk too high to rely on it. Question 8. A patient with advanced Hodgkin's disease reports severe fatigue, shortness of breath on exertion, and pallor. Labs show hemoglobin 7.8 g/dl. What is the nurse's priority assessment? A. Lung sounds. B. Bowel sound. C. Cardiac status. D. Neurological reflexes. Answer. C. Cardiac status. Rationale. Severe anemia, decreased oxygen delivery, risk of tachycardia, arrhythmias, heart failure. Cardiac monitoring is essential. Why not the others? Lung sounds, useful, but not the immediate concern. Bowel sounds, not related to current problem. Neuro reflexes, not directly impacted by anemia. Question 9. A patient undergoing radiation therapy for Hodgkin's disease develops painful oral ulcers and difficulty eating. Which nursing diagnosis takes priority? A. Imbalanced nutrition, less than body requirements. B. Acute pain. C. Risk for infection. D. Impaired skin integrity. Answer. A. Imbalanced nutrition, less than body requirements. Rationale. Oral mucositis, inability to eat, malnutrition, delays recovery. Priority equals maintaining nutrition for healing. Why not the others? Pain, important, but secondary to nutrition. Risk for infection, real, but nutrition deficit worsens immunity further. Skin integrity, less immediate compared to nutritional compromise. Question 10. A patient with Hodgkin's lymphoma completes chemotherapy and asks, "Am I cured now?" What is the best nursing response? A. Yes, Hodgkin's disease is always curable. B. You will never have to worry about this cancer again. C. Many patients achieve remission, but regular follow-up is essential. D. It depends on whether your lymph nodes shrink completely. Answer. C. Many patients achieve remission, but regular follow-up is essential. Rationale. Hodgkin's has a high cure rate, especially if detected early, but follow-up scans and monitoring are vital to confirm remission and detect recurrence. Why not the others? Always curable, false, not 100%. Never worry again, unrealistic and misleading. Depends on shrinkage, too narrow, misses the need for long-term surveillance. And there you have it, 10 NCLEX-style questions that took us from painless lymph nodes to critical nursing priorities. Hodgkin's disease may be rare, but for those who face it, your role as a nurse can mean the difference between fear and hope, between relapse and remission. Remember, early detection, systemic understanding, and patient-centered care are the true weapons against this disease. If you found this quiz helpful, imagine what mastering more topics can do for your confidence. Subscribe to Nursing Blueprint, where every question brings you closer to becoming the nurse you dream to be.